All right. Good evening, everyone. Thank you so much for joining us. My name is Surjean Dalma, and I am currently a doctoral student at Columbia University, and I'm an oncology nurse practitioner. So it's really an honor to welcome you all on behalf of the Columbia Nursing Pathways Collective Club, or as we like to call it, CNPCC. Okay. So before we begin, I want to briefly share who we are and why this event matters to us. Okay. So let me just switch to the next slide. The Columbia Nursing Pathways Collective exists to redefine what's possible for nurses, redefine what a nursing career can look like. We are rooted in the belief that nurses belong everywhere decisions about health are made. Our goal is to equip nursing students with the knowledge, mentorship, and industry connections needed to thrive not only at the bedside, but across the full landscape of healthcare. We focus on opening doors into entrepreneurship, health tech, consulting, venture capital, policy, leadership, and beyond. And our aim is to create pathways that honor our clinical expertise while embracing innovation. At our core, our mission is simple. It is to build a supportive community of forward-thinking nurse leaders who are ready to transform health systems, elevate patient care, and help design the future of healthcare. So we're grateful for each of you for being part of this conversation and for contributing to a vision of nursing that is bold, that is expensive, and deeply impactful. So before we begin, I'm going to say that my name is Surjean. I am also the co-founder and the president of CNPCC. I have other amazing co-founders here, Jiro, my co-host, and Marie Tupil. Jiro, you can say a little hello.
Yes. Hi, everyone. My name is Ejeron Takume. I'm so excited to be here with you all tonight. I am a public health practitioner and currently am in my final year at Columbia School of Nursing. So I'm super excited. I'm also a co-founder of this awesome club that I co-founded with Sergine and Marie, who is not here. And we are led by Dr. Ferrara, who's also on the call. So happy to have you all here. Thank you for being here. And I'm excited for our discussion today.
Exciting. These are also our amazing team members. They're also serving on the e-board, Rakidra, Hanan, and Ame, and our various roles. And this could not be possible without all of their help. Okay, this is amazing. And finally, another person this could not be possible without. I want to take a moment to acknowledge someone whose leadership really has supported us throughout this entire thing, Dr. Sirfan Ferrara. That He's a professor at Columbia and he's also the club advisor. He's really a national leader, international superstar here. Um, so we're very grateful for his guidance. And I'm gonna let Dr. Ferrara give a few remarks about his involvement with this club and all he's done for our community.
Thank you, Sergine. So I want to wish everyone a good evening and welcome. It's a pleasure to see so many Columbia nursing students, alumni, and colleagues joining us for tonight's event. As the faculty advisor and as someone deeply engaged in the intersection of nursing and I want to begin by recognizing the vision and dedication of our student leaders who organize this program. Their work reflects both the curiosity and the ambition that are driving the future of our profession. We are at an inflection point in healthcare. Across clinical practice, research, education, and systems innovation, technology is reshaping not only what we do, but how we imagine what is possible. AI, digital transformation, and health tech are not abstract ideas on the horizon. They are here, influencing care delivery today and creating new opportunities for nurses to lead. And that is exactly why tonight's conversation matters. One of the things I appreciate most about the Pathways Collective is its commitment to redefining what nursing careers can be. This group understands that nurses belong everywhere decisions about health are made, and they are building a community that helps our students explore these broader possibilities. Whether you are drawn to digital health, entrepreneurship, consulting, policy, or emerging leadership roles, the Pathway Collective is creating the mentorship, connections, and support to help you chart those paths while still honoring the clinical expertise at the center of our profession. Tonight is a reflection of that vision and an invitation for all of you to imagine where your careers might grow. Our panelists exemplify what it looks like when nurses step into spaces of innovation and shape the direction of change. And they are wonderful people that I can call friends as well. Each of them has forged a path that extends beyond traditional boundaries, advancing data science, informatics, entrepreneurship, and digital health leadership. Their careers demonstrate that nursing expertise is not only relevant in these domains, it is essential. Finally, I want to thank our moderators for their leadership and for creating a space that elevates nursing voices in emerging fields. And I will turn it back on over to, I think, Sergine. I think it's back to you.
You're right. We're going to dive straight into it. All right. We have this amazing event called Beyond the Bedside, Nurses Leading an AI Digital Transformation in Health Tech. So I will start with reading the bios of our amazing, amazing panelists. So I'll start with Rebecca Love. And Rebecca is an internationally recognized nurse executive. She's an author and an advocate for nurse-led innovation. She serves as the chief clinical officer of Quadrivia, a health technology company developing Q, an AI-powered clinical assistant designed by clinicians to support healthcare professionals in real time. And at Quadrivia, Rebecca leads the clinical vision to improve care delivery, reduce administrative burden, and enhance provider workflows. And funny enough, Rebecca is also my boss. So thanks, Rebecca, for being here. Appreciate her. Rebecca is so amazing. She's also the visiting professor and an entrepreneur in residence at Florida State University College of Nursing, where she co-directs the Nursing and Artificial Intelligence Innovation Consortium. This pioneering effort launched the nation's first Masters of Science in Nursing, a program with a concentration in AI, aligning academic excellence with industry innovation to shape the future of technology-enabled nursing care. The first nurse featured on TED.com, Rebecca has been recognized as a LinkedIn Top Voice, a Forbes Business Council contributor, and was nominated as one of modern's healthcare most influential people in healthcare. And her insights have appeared in Forbes, BBC, Stat, Becker's, Fortune, ABC News. I mean, you name it, she's done it, honestly, at this point. She's also a founder. She founded and sold HireNurse.com and led the US market for Rialto UK, created the first nurse innovation program at Northeastern University, co-founded Soncial, and launched the Nurse Hackathon. And also, since she had some time in between, she founded the Commission for Nurse Reimbursement. So honestly, Rebecca, she's a co-chair of the Nursing and STEM Coalition, and Rebecca is an advocate for federal recognition of nursing as a STEM discipline. Thank you so much for being here, Rebecca. I'll leave the Ejiro to introduce the rest.
Oh, wonderful. So I'm going to go ahead and introduce our next guest speaker, Dr. Maxim Topaz. He is an associate professor of nursing and data science at Columbia University and a senior scientist at VNS Health, which is also the USA's largest not-for-profit home healthcare provider. Really great. So he's also a pioneer in applying natural language processing to nursing documentation, and his research leverages AI, text mining, and automated speech and video processing to improve healthcare delivery. He has secured over $25 million in federal funding and published more than 200 articles focused on AI solutions that predict patient deterioration from nursing notes, enhance clinical decision making, and reduce the documentation burden for frontline nurses. So he's here to make our lives easier, y'all. Currently, he is developing innovative AI applications that are specifically designed to address nurses' daily challenges in practice. With clinical experience in internal medicine and urgent care, Dr. Topaz also carries a PhD from the University of Pennsylvania and a postdoctoral training at Harvard Medical School. Dr. Topaz uniquely connects nursing practice with cutting-edge technology, and his contributions to health policy, leadership, and entrepreneurship have earned him fellowships from the American Academy of Nursing, the International Academy of Health Sciences Informatics, and the American College of Medical Informatics. So thrilled to have you here with us today, Dr. Topaz. Oh my gosh, y'all, all the claps. I'm adding to the claps. Hey, and our third and last but certainly not least guest presenter I want to present to you all today, Dr. Kendrick Cato. He is a informatician, excuse me, I always get mixed up with that. He nurse scientist and expert in AI-enabled decision support. He is a professor of informatics at the University of Pennsylvania and a nurse scientist for pediatric data and analytics at the Children's Hospital of Philadelphia. Dr. Cato's research integrates machine learning, clinical decision support, and human systems designed to improve patient outcomes and clinical experiences. His work spans outcome. His work, excuse me, it spans predictive analytics for early detection of patient deterioration, environmental and social determinants of health, pediatric cohort studies, and optimization of nursing workflows. He has led multi-site research collaborations within major academic health systems. He's conducted randomized controlled trials of AI-driven CDS tools and developed novel frameworks for AI literacy and governance in clinical settings. Dr. Cato is also teaches and mentors interdisciplinary trainees in applied AI for healthcare, data science, and implementation science, and he is widely recognized for advancing the responsible and scalable integration of AI into nursing practice. So before we get started, let's just give them one more round of applause. I see all the accolades, y'all. Yes, we are so thrilled to have them. And so we're going to go ahead and deep dive into our questions because we have a lot of them and we got your questions that you all added as well. So I'm going to go ahead and start. And this question really is going to be for all three of you. Now, before we dive into AI solutions and all the stuff that people want to hear, I really want to ground us in where nurses actually are today with artificial intelligence. There is a lot of hype, news and media, and also a lot of concerns and fear, and also some real excitement about what's really possible when it comes to artificial intelligence in nursing. So we want to start by understanding the mindset of the nursing workforce right now and what's driving both the optimism and the hesitation in the nursing space. So we often hear that AI won't replace nurses, it will augment them. Yet nurses do remain cautiously optimistic and protective of quality and human connection. Some of the questions that folks have here, they'd like to know is how do you all interpret where nurses truly are today and their feelings about AI, and what's driving both the optimism and the fear that many of the nurses today carry?
Anyone can take it.
Yeah, so I'll start first. So I think what's driving the optimism is, in my tenure working in informatics, in IT, and in data science, there's a lot of nursing science questions and problems that nurses haven't been able to address as robustly with with AI or other technologies that other clinicians have been able to address. And I would say in the last 3 years, we've seen that really start to change. And so nurses are really excited about that. I think the apprehension that I see is the fact that we live in a resource constrained environment. I am a child of I'm West Indian. I'm a child of a West Indian nurse who was sponsored by Brookdale Hospital to come to the United States. And so these resource constraints aren't new, but they seem to be getting even more tightened. And nurses smartly recognize that that the healthcare industry, the system, will try to optimize resources as much as possible, and they're concerned about how that'll affect them. That's the way I see it. But so I think those are the two major fears, and then there's some other ones that we can get to later.
Yeah, awesome. Thank you so much for that insight. Dr. Topaz, Rebecca.
If I could follow on Dr. Ketter, I think that, you make a very good point. And I think that what's really exciting to me, and I'm going to be curious to hear Max's opinion on this as well, is largely nurses have been left out of data, right? We were rolled into room rates in the 1930s. We're the only profession that is not in data. Data right now is driven by EHRs. Since nurses can't bill for the EHR or any activity that they do, all of their workflows are missing from that. I think for AI to work, AI is going to force the healthcare industry for the first time ever to start tracking data around nursing workflows, outcomes, impacts, and workloads in ways that have never been done before. And Max, I tacked on a post not too long ago that the rumor on the street is that AI plus nurses are going to outperform most other deliveries of medicine in healthcare in very short order. Why? Because just the same way that nurses right now are the translators of everything in every healthcare setting, they are the ones who put all the pieces together to make healthcare work. The only way AI is going to work in healthcare is with nurses translating what has never been documented so that the outcomes can continue to increase. So I think there is excitement. I think there is fear because you've seen just nurses from Kaiser Permanente being the most strong out there striking because they are being forced to implement AI solutions that they feel is not actually vetted, tested, or trusted by them. And I think we're going to head down a path where either there is alignment and recognition that there is going to be an important role for nurses to actually undertake and lead, or there's going to be a further breakdown between those pushing for AI and those delivering healthcare on the front lines. So I'll turn it over to Dr. Topaz.
What a great remarks from previous speakers, and thank you everybody for joining. I see some familiar folks here from the US and abroad, so that's cool to see you. Thank you for joining. All right. So in terms of nurses, so at Giro, I think well put, there is a cautious optimism about AI among nurses. That's what I hear.
Yeah.
And some of the excitement that I hear comes from burden reduction, right? The promise in the current technology to reduce burden. And our research shows that about 40% of the nursing time is spent on some type of documentation, administrative tasks, right? So if technology has the potential to make some of that go away, that's a fantastic thing. And I see, clinicians in the field are very excited about that. The other piece, I agree with Rebecca, comes from the excitement about finally realizing the potential of nursing data and start seeing detailed nursing workflows, detailed nursing tasks being captured much better in much more granular way, which will allow us to understand what's the impact of our action on the patient outcomes, right? What makes patients feel better, what makes them healthier. So these are some of the promises, right, that I see that people are excited about.
Yeah.
And then there, with that, there is a lot of caution. And one thing that I hear frequently from clinicians, from nurses, they're wondering if AI is going to replace us. I personally don't think so. Hopefully some of the burden is going to be replaced by not the whole profession of nursing. I'm pretty sure about that. So some of the caution comes from that. And then, people who really have the opportunity, have a chance to interact with some of the cutting edge technologies are concerned about increasing automation. So things are being automated, right? Where's nursing in all of that? And a big concern I hear is about being left out of the technology development, implementation cycles, right? How it happened with the electronic health record. It's a fantastic technology, right? It has so much promise. But when you look at what happened in the end with electronic health record, where are we today? These systems are decent. They're very complicated. they capture only a very small fraction of information about patients. So they capture very little about patients for multiple reasons. That's where we ended up with this, right? And these are kind of state-of-the-art technologies that capture very little and are not helpful, and we spend a lot of time on. So there is a fear that with the current AI technologies that are happening, that are being implemented into practice, like ambient listening, for example, that's something like that might happen if nurses are not involved. So this is my 5 cents.
Definitely. Thank you so much, Dr. Topaz. So great. Thank you all for acknowledging the concerns, because people really do have concerns. And I think I can also appreciate that there is some optimism there. We see that you all are at the forefront of work for us to make sure that our voices are included. So this definitely helps ground us and kind of get us rolling. So I'm going to hand it over to Sir Jean so we could talk a little bit more about some of the innovative things that you all are doing.
I know, right? So, I mean, we've grounded ourselves in how nurses view AI, right? So I want to shift to the idea of nurse-led innovation, really. Technology will only work in healthcare if the people closest to patients help design it, right? It seems like it's a theme from all of you all. So let's talk about what true co-creation looks like, and how do we prepare nurses to lead and not just follow in this era of AI. So from your perspective, what does a meaningful nurse involvement in AI design look like? And what does it take to really ensure that nurses are co-creators and not just passive end users? That's also open to all.
All right, I'll go first on this one, and then I'll turn it over to everyone. I'll give out 2 shout outs also to 2 colleagues of mine who I think are the first nurses I know that are actually leading product in healthcare. One is Rob Fraser at Sword Health. He's based, I'm sorry, not out of Swift Medical out of Canada. And the other is Rick Renard out of Sword Health out of the Netherlands. These are the first times nurses have actually been appointed to lead product. And why that's different is that there was a clear understanding that as AI started to develop in these technologies, one around wound care and then the other of delivery of care, interestingly, largely in the physical therapy space, there were too many gaps in the traditional models that were being built when you were looking at AI, from delivering services built on generative AI at scale, to understand that the technology that would be traditionally built kept failing. Right? There was too many blind spots and understandings either from physician-based or physical therapists, because the delivery and coordination of care largely still falls with nurses in these spaces. And what you find is remarkable is the complexity by which replicating even simple tasks by humans, think of something even as simple as an appointment reminder, actually is an incredibly complicated skill delivery for AI to manage. There are things that we refer to in AI all the time, which was called happy paths. Those are the predicted behaviors of best outcomes in AI. But all of you guys on this phone know, as nurses especially, that most of the time, anytime you're engaging with somebody with regards to healthcare or medicine, they're not at their best, right? They're actually dealing with a crisis, an acute situation, a chronic disease, that they are not performing at those. And it is complicated, and it is messy, and it is often emotional. And AI does not do a good job outside of differential diagnoses from large language models in actually managing complexity repeatedly, routinely, and definitively in a way that actually enhances the delivery of outcomes. So I think what is going to happen is that as more and more companies dive into AI in spaces, they're going to recognize that the AI, the large language models, are going to get them 85%, 90% of the way there with regards to general information, especially probably far better on differential diagnosis. And why I say that differently is that everything that physicians know and do and workloads outside of like 1% is well documented. It's in all the research, it's in all the textbooks, all of their workloads, all of their workflows exist in large publications. Those have been ingested in large language models. The nursing workforce has not. And I think the future, and I think it's going to become smarter and smarter, you're going to start to find that all of these companies, I was recently with a large consulting house and one of the biggest in the world, and they told me of their entire clinician workforce, over 30,000 of them, 94% of those are nurses. Why? Because the reality is that when it's delivering healthcare and change management and symptom understanding, it is going to be nurses that understand how to deliver that care. So I'll turn that back over to you guys. I hope it didn't go on a tangent, but I think the world is changing, and the future of AI is going to elevate the roles of nurses far greater than any other system ever has, because it was never built for healthcare in general. EHRs were built for payers, which meant physicians got focused on. Other kind of technology was focused on reimbursement perspectives. And right now, AI can't just deliver that if it's going to be as transformative as the technology has promised to be.
Yeah,
thank you, Rebecca.
Go ahead, Max.
Yeah, that's hard to follow that and go before Kenrick as well, but I'll try. So I think, my take on that is that there is an uncomfortable truth when you think about the situation right now. So most of the AI tools or most of the technology tools that are entering and have already been present in nursing practice today were designed by engineers, sometimes with some involvement of physicians, right? And very few nursing. And this means that with nursing needs treated as an afterthought, right, to some extent. So that's what we have today. When we are absent from the design room, from designing those solutions, somebody else decides what nursing work counts as real enough to capture. A good example of that is ambient AI scribes that are being actively designed now by multiple places across the country and internationally. And that's really interesting because there you get to see active development of those technologies, and then you get to see who gets to decide what counts, what is going to be documented by this ambient AI system. So imagine there is going to be an ambient AI system. And again, about 30% of physicians in the United States right now use those systems, and those systems roll out to nursing at a very fast speed. And I see and hear about those systems every other day. And again, my knowledge comes from clinicians telling me about that rather than us in academia trying to figure this out and spending, 10 years answering those questions, which we did before. It was awesome. We spent a lot of time, did a lot of troubleshooting, understood the problems. But now the pace is so fast that we're not keeping up. So this technology is a good example of something that's, I've seen a good amount of involvement by nurses in this technology's development, right? That's on one hand. And that means that when those ambient systems are going to listen to what the discussion is between us and the patients, they're going to be documenting accurately. They're going to be capturing our care pretty well. And you can imagine if somebody who is not as involved in nursing, who doesn't understand the domain, would design those systems, they would not capture what we do. They would not capture nursing well, right? So that's a good example. That's what I got to see. And
Right.
thinking about that I've been thinking about it for many years. We have a collaborative we call the International Leadership Collaborative for Nursing AI, NAIL. With this collaborative, we thought about that. We developed several position papers that were pretty effective in terms of describing that at each point of technology development, nurses should be integrated as partners, right? And not as an afterthought. So there is this, and that's what we are trying to do in our research environments these days, specifically my team. But again, there needs to be a collaboration between, as Rebecca mentioned, companies that disseminate those products and help build those products, disseminate, right? And then practicing clinicians and academia. I think this three party collaboration has to happen for the technology to really work well, be safe, accurate, and effective in helping us achieve better patient outcome. And I will turn it over to Kenrick.
Yeah, Kenrick, we would love to hear your thoughts on this, but also because how has AI documentation, AI scribes, Max, you just mentioned it, enters hospitals, home care settings. What are the safeguards or governance frameworks that are essential, you think, especially to prevent bias, errors, or really over-reliance sometimes on automated outputs?
Yeah, that's a great question. So, as Max just mentioned, we are in an era where a lot of people are testing, piloting, nursing ambient we're doing it at Children's Hospital of Philadelphia, and we're also doing it at Penn Medicine. And we went live with inpatient nursing documentation at Penn Medicine about a month ago, and we're actively I'm helping to actively evaluate it. What I would say is, in robust organizations, and one of the things I think we should back up and talk about when we talk about all these things, is that I think that there's a large there's a large digital divide in this country, and it's only being accelerated by how AI is rolling out and being implemented. So a lot of the places and a lot of the things we're talking about when we talk about AI are basically high resource settings, right? And so at the high resource settings, like the places that I work at right now, we have robust governance structures to actually do the evaluations ahead of time to make sure that that the models are working equitably, and more importantly to do it over time as after implementation, and as you're doing stuff prospectively. I still think though we still don't have robust enough frameworks for the underlying large language models that we use. I don't think we're there yet. And so there's still a lot of work to be done. We don't have enough nursing. Rebecca was talking about this. We don't have enough nursing training data in the that have been used to train and update the models, to build and then update the models that fine tune the models that we use. And then finally, something that I've seen very close up is that there is demographic level bias in clinical care in our country. And so that is reflected in the data. And so, and that's connected to, we haven't developed a robust enough, I think, frameworks to make sure that we can deal with that. And so it's a work in progress. Those are the things, and I think, to me, those things continue to lead to a widening disparity gap, and a widening, and then also, the available resources, a widening digital gap in which folks are going to see the effects of these great tools and which ones won't.
Right. You're absolutely right on that. And I think, just not to put you on the spot or anything, but I know that you mentioned that there are some things are already being developed at the hospital you're at. And can you give us an example of what's going on so we can
Well,
like
I mean,
see?
there's a bunch of things. So I think, the things that we're implementing are large vendors, the Epics, the Microsoft. There's a bunch of ambient companies that are being implemented and tested all over. A Bridge is another large ambient company all over the country. I think specifically at places like CHOP, one of the things that we've done is we fine-tuned our own large language model with all of the, it's hard to imagine, but all of the electronic patient data that we can find. So that's going back a decade and a half of data, and we update it every month. So that allows us to have a large language model that can answer any question about any child that's been seen in CHOP, right? But then there's some things that seem very kind of simple, but building large language model tools to help clinicians and staff answer questions about things like, what's the leave policy for what's the leave policy for me if I live in New Jersey as opposed to if I live in Pennsylvania, right? Like, these are things that as a staff person, sometimes it's hard to find that within the organization. So and then, we're doing some really interesting things also with audio and video as well at University of Pennsylvania, where there's a lot of work, and Max has worked on this too, where we have both audio and video information where you can understand things about patients and children. You can understand children that are in pain, that are nonverbal, and if they're developing appropriately. In older adults, you can understand if they're having cognitive decline. And so we're doing a lot of that work as well.
That's perfect. And just to go back to Rebecca very quickly, because you are at Quadrivia and you're developing Q, and I wanted to give the audience a little bit of insight on what exactly is Q and how the work you're doing over there.
Well, thanks, Sergine. No, we're really focusing on developing an agent that basically can help support healthcare practitioners in the delivery of healthcare. Largely, you guys think about this, all of the routine, repeatable tasks that nurses are burdened with doing that keep them from practicing to top of license. Think largely in ambulatory spaces, the phone calls that we're doing that are repetitive and routine, everything from prepping people for mammograms or colonoscopies or appointment reminders or calling about routine, normal lab results. These things keep nurses from doing things because we are not allowed to hire other people to do those menial tasks. So everything that is downflowing at the top is coming down to nurses to do those things. So really what we've been spending a lot of time doing, and you're hearing this in scale largely being implemented in administrative ways, we believe at the future of Quadrivia that the power that's going to be unlocked is combining clinical AI assistance to support these clinicians, to support them, elevate them, understand the backgrounds in healthcare, and border into clinical spaces that then unburden the clinician to be able to deliver the most complex care. And I think to the points that both Kenrick and Max have been making, the complexity of healthcare delivery is coming down to data. AI is only as good as the data that comes in and the data that comes out. And much of that data right now is still heavily flawed or misguided or not representative of the populations that are managing. So when you ask questions, is AI going to replace nurses? I don't believe it's going to replace nurses. What I hope it does for the first time is actually unlock the incredible knowledge nurses have and the intelligence that they have in which to practice, because the tasks that we're given credit for are often menial in design, but the impact of the work that we do is largely hidden from the outcomes of the impacts to the patients that is seen. And because of the billing situation, the credit is often given back to the physician or the physical therapist or the occupational therapist, because those billable codes were what was tracked for the success of the delivery. And for the first time ever, I think what we hope is that by actually creating clinical AI assistance that will support nurses, we're going to start unlocking the true capacity, intelligence, and the absolute impact and knowledge that nurses are having on the workload. Now, in full disclosure, I don't believe that Quadrivia will ever stop just supporting clinicians from the nursing space. I think the true revolution is going to come with regards to redesigning the way we work today. Because AI, if we're trying to put AI into the design of how we deliver healthcare today without redesigning how the workload and the workflows are, we actually are limiting the potential by which we can actually achieve greater opportunities for nurses specifically, but also the opportunities for us to see mass amounts of patients at scales. Because as you started this conversation, Jiro and Georgine, more than half of the world's population have no access to healthcare at all. It is an issue that we simply cannot produce enough people to see the demands that exist in healthcare. Kenrick pointed it out. And this supply and demand is never going to be equalized. Even if you guys may or may not know, we graduate 185,000 nursing students a year in this country, a 250% increase over the last 15 years. We graduate more nurses in this country than any other profession combined. And in fact, 2 years of graduates actually surpasses the entire nursing population in the United Kingdom. We are producing plenty of clinicians. We're not retaining them, but also we are not resolving the problem of access and to supply and demand, and the potential for AI to open up that digital front door and deal with those chronic, repeatable, routine tasks so that real patients can speak to a nurse with a real problem and get access to the right care at the right time, to me is the greatest hope for the potential of what we're building and why I'm spending my time in the space that I am today, because it is a complex problem that I hope doesn't only change access to global narratives, but to so many people in our own country who have never been able to access care.
Exactly. Very well said. I think we've gotten some really great insight from all of you talking about AI documentation, AI scribes, ambient AI, and clinical assistants, both in the hospital setting, but also in the community setting, which is very important. But I want to take it back to one thing you mentioned, Rebecca, when you were talking about reimbursements. And I thought that was such a key point that we should definitely talk a little bit more about. So, has AI really becomes embedded in care delivery? How do you see the payment model evolving, right? What would be a reimbursement framework? Like, what would it look like that to really recognize the economic value that nursing provides? And really just preventing AI from being used, simply as a cost-cutting mechanism.
Well, so it's really interesting that you say that because actually the American Medical Association is the organization in the country that controls all CPT codes in the United States. Now, interestingly, as of 2026, they're already putting forward 288 new CPT codes to actually bill for AI. So at this point in time, you've probably all seen the studies, specifically largely coming out of MIT, but also Max, I think you shared a study that just also came out of Mount Sinai that also showed that actually most AI projects in healthcare and in almost all other divisions of delivery actually are proving no ROI, return on investment. We're spending more on AI than any return on investment that can be calculated from a dollar expense. Very quickly, AI would fail. And so why do we see the acceleration of the American Medical Association to put forward 288 new codes specifically around digital health and AI is specifically to address the issue of reimbursement. Now, I'm not going to lie. The Commission of Nurse Reimbursement for 3 years has been on Capitol Hill fighting to get nurses unbundled from the room rate. Most people at the federal levels believed that the dollars that are sent to healthcare systems supported the nursing workforce. In fact, only the time during the pandemic under the CARES Act was the first time the federal government actually gave dollars specifically designed to support, hire, and retain and pay nurses. It was the only time in U.S. history. And as soon as those CARES dollars went away, all of the money invested into hospitals went back to the traditional model of rolling nurses into room rates, and all of those dollars have existed. The argument is that it is too complex to unbundle nurses from room rates and to actually create reimbursement codes. However, suddenly, in the age of brand new technology, in which every investment has showed that has largely failed in the rollout of AI because there is no return on investment, suddenly within under a year, the American Medical Association is putting forward 288 new codes. What that means is that as of the next year, I guarantee you'll see the models and the returns of investment vastly different. Numerous more companies coming in to say, now you can bill for AI to make a phone call. Now you can bill for AI to do X, Y, Z. These situations did not exist a year ago. I unfortunately don't believe it's necessarily a win for nurses, but perhaps a better argument for us to bring forward that if you can reimburse for AI, you should certainly be able to reimburse for nursing. Because fundamentally, as you guys may or may not know, I hope some of you guys are studying business. In business, if you are a cost, we cut costs. As nurses are a cost to healthcare systems, we don't invest in them. As we're seeing at the most national, federal levels of even the Department of Education refusing to recognize nursing as a profession, diminishing the amount of student loans that one can actually qualify at the federal level, we recognize we have a narrative we must correct. I hope in the future that the movement of AI getting reimbursed will open the door for nurses to get reimbursed. And in the future, we're going to see a combined effort to actually amplify the work that they're doing. But I do not think this is easy, nor do I believe it will be easily won. So I don't know how else to speak to that. It's a much larger conversation on not having a nursing reimbursement model, one that actually the American Medical Association has fought historically since the 1960s with 3 separate times that nurses have tried to unbundle themselves from room rates, both in the 1985 as well as in the year 2000s, and was just told it's impossible. We don't believe that. The same reason we're fighting for nursing to be qualified as a STEM profession, but those are larger policy issues that I hope more nurses will get involved in.
Yeah,
Well said.
and just so to go off Rebecca's remarks, right? And thank you for advocating for reimbursement for technologies, nursing practice. Thank you, Rebecca. That's great efforts that you're doing that I'm aware of. So just to mention briefly, the elephant in the room, the AI bubble that everybody is talking about. So I looked at some numbers, and right now AI investments account for about 75% of S&P 500 gains since 2022. That's very recent, lots of investment. One example is NVIDIA valuations exceed Germany's entire GDP. Healthcare AI adoption specifically jumped from 3% to 27%. I would be very excited about those numbers a few years ago. Today, I'm very concerned. And this is, again, that happened within 2 years. According to some reports, this is the fastest AI growth rather than any other industry. But when we look at this, right, when we look at what's going on with AI in healthcare, we find that many of those AI projects, they die out at the pilot stages, right? So, not much is translated and stays in practice. AI pilots fail to deliver return on investment, and we briefly mentioned that already. Nearly half of digital health startups have less than a 12-month runaway, unfortunately. So it's a tough world out there, right? Lots of investment, but a lot of that doesn't succeed. So when we talk about reimbursement models for AI and nursing, I think we have to ask, are we building payment structures around technologies that might not survive the next market correction, right? So people are talking about bubble exploding, this market correction is coming up. My concern is that if AI becomes a cost-cutting mechanism first, and then care improvement tool second, as we are, seeing some of the examples right now, we'll see reimbursement models that squeeze nursing rather than recognize the nursing value. And any payment framework, I think, needs to reward outcomes, not just efficiencies, right? And there can be efficiency gains, right, with AI, but we need to see that this results in value, right? So imagine documentation time saved by the ambient AI listening systems. It would be converted into you seeing more patients. And we want this to be converted into value time with your patients, value time thinking about care, things like that. And that's the elephant in the room that I wanted to briefly address here.
Thank you so much for adding your insights into that, Dr. Topaz. And even while we're here, I just want to kind of elaborate or just kind of expand a little bit on some of the things that were highlighted from Dr. Cato and Rebecca. Earlier they highlighted some things about bias with AI and just how these things are being created without us at the forefront. And given some of the work that you've done, Dr. Topaz, I know some folks would like to know what are some of the unique risks that arise when deploying AI in home health versus the inpatient settings, given kind of the work that you've done and the work you've been able to secure with clinical research.
Yeah, great question, right? So as a preview, in the home is a very intimate setting. It's very different from anything that's done inpatient, right? Because imagine when you go into inpatient hospitals or even ambulatory care or primary care, this care is happening within the clinician premise, right? So clinicians can run the show, and some of the things are built around that, right? Electronic health records, things like that. Now, when we start thinking about moving towards the home where care should happen for most of the people, right? Hospitals account for a very small percent of your life, right? And usually, again, that's an end-of-life care. That's necessary, but most of the care happens in the home, right? Yeah. So there is a huge potential in the home with AI. Now, to your question about the differences and some of the risks, right? Again, home is a very intimate place.
Yes.
And people are, there's a bunch of concerns about privacy with those emerging AI systems. So a specific example of technologies we're developing these days, as Kenrick mentioned, we are increasingly starting to use ambient listening systems. So basically imagine a recorder that would record, audio recorder that would record communications between patients and nurses, and then help document better, and also help nurses decide on the interventions, and other clinicians that are visiting the home decide on the best interventions, look at the most recent cutting-edge evidence, things like that. So it's increasingly possible, and again, expanding on data sets, right? We're increasingly using patient-nurse communication, verbal communication, right? That's a cool data piece that we haven't touched before as much. And we are moving towards using video. So imagine a clinician with glasses that are going to record video to some extent, right? And analyze what's going on. there is lots of wonderful biomarker type opportunities for data extraction, right? So my former trainee, Miriam Zalnouri, she's a professor at the School of Nursing at Columbia. She extracts dementia status. So she identifies patients with dementia using their speech, basically, right? And you can do that. We're moving into the era where you would extract lots of biomarkers from video. And, it's increasingly apparent with AI, you can analyze videos, you can extract, respiration rate, and, some of the hands-on kind of things, that vital signs, right? Things like that. And there's going to be an explosion in that. We're going to see more and more of that happening. And there's so many risks, right? And people are reluctant to see those technologies integrated in their homes. And clinicians are concerned about what's going to be done with their data, right? So there's so many things that we need to figure out. And, so from patients, I think we hear about privacy risks. What is that data going to be used for? But also, on the other hand, we hear positive things from the patients. They want to see this data, actually. They want us to have this data to help us make better decisions about their care, predict what's going to happen to them, right? And then provide care. On the clinician side, there is a bunch of concerns about what is going to be done with this data, right? So imagine being recorded, right? If an encounter between the nurse and the patient in the home is being recorded. This data, if it were to be stored somewhere, right, in a database, and there would be a legal case in a few years, somebody is going to come and sue for malpractice or anything else. This data is going to be excavated, examined, and who knows what we're going to find there, right? So there is a bunch of concerns from clinicians that we hear about that. And also specifically what's going to be done, right? Is this data going to be used to evaluate my quality of care, things like that. So clinicians are concerned, and these are not unique, right? These concerns exist in the hospital, but that's what we hear from clinicians in the home.
Wonderful. And then one more question for you, Dr. Topaz, before we transition, because I do want to highlight, you have secured 25 million in funding, which is a lot of money to be able to execute some of the studies to understand the efficacy of some of these tools. In addition to the ambient listening, the use of video, extraction of biomarkers from video to be able to assess some of these things, are there any research areas that are most urgent to strengthen evidence base, right? Because that's what we're using to assess, implementation of these tools. Any areas that you feel are the most urgent?
Yeah, there is so much that's going on with the technology, right? That dramatically matured in the last couple of years, right? So I've been working in this type of technology, natural language processing, we used to call it, right? It's basically text mining, so anything to do with text, right? That's my core expertise. I've built software and that for years, right? And then my software fortunately became irrelevant in the last couple of years with the advent of ChatGPT and other chatbots, right? Those large language models that can really understand things. So, we witnessed this magic growth, I think, in the last 3 years. The baby that it was, ChatGPT, right? If you ask it 3 years ago, different questions, you would be very surprised what the expectations are today versus 3 years ago, right? Like you wanted to make a coherent sentence, say something that's related, and that was good enough. Today, you expect those systems, and that's what we see. Those systems, they can do. So one example, right? A recent editorial we published was about the systems that look at the most recent cutting-edge literature that's being published in seconds, analyze this literature, and then provide recommendations for care, right? And imagine, those systems exist, right? They call deep search, usually some type of deep search or this or that, and they do systematic literature reviews in minutes. They're better than humans in doing that. There's a bunch of evidence that's been accumulating, and those systems get better by the day as well. So for me, when you ask about like the urgent things to do, right? Some of the urgent things have to do with integrating those systems into clinical practice. So nurses leading integration of those systems into clinical practice. Imagine the smart assistant, right? It's going to listen to everything that's going on and then go on the internet, identify the most recent studies, right, that were done, randomized controlled trials or not, and then recommend care specifically for this person based on what people said, maybe some of the video elements that were collected. I think this is a very, so it used to, like, that was the dream always, I think, for us in health informatics, right? You know, these were the systems that we were dreaming about for many, many years. Today, they're becoming reality, right? The technology is there. You can ask ChatGPT to do a deep search. It's going to go for a few minutes and then come back with all of those wonderful recommendations, wonderful results based on most updated literature. So all of that it makes me very excited about this technology, right? And kind of, you know, the next things to do have to be about integrating those technologies into clinical practice, having nurses lead those technologies, their implementation and development, and then, you know, increasingly complex data that would include audio and video and help us document less and hear the patient voice much better than we used to have. So this is some of the most exciting opportunities in my view.
Awesome. Yeah, thank you for highlighting that. And then I just want to kind of ask the question to you, Dr. Cato, because I know that you are doing a lot of really amazing work as well in research. And we talked a lot about with all of you about just implementation and rolling out and what that looks like. But I know some folks are curious to know, Dr. Cato, based off of your work, how do you evaluate whether AI tools are improving workflows or introducing some of the hidden burdens that you know, you all talked about earlier?
Yeah, that's a great question. You know, I mentioned before that I'm a clinical informatician, and you know, we like to say in clinical informatics that informatics is about people, process, and technology, right? And so the technologies change. AI is just one of them. It's been around for a while. It's being used more and more. But for me, the outcomes that I care about are the process and people outcomes, right? Whether it be with patients, caregivers, or clinicians. And so there are a couple of things that I always think about. And, you know, Max talked about documentation burden, for example. A lot of people are paying attention to the individual effects of or possible individual effects of these technologies, reducing the burden on an individual. But for me, actually, what's more important is is the care delivery, are the processes being changed, right? Is the technology changing the processes? Because as Rebecca mentioned, the way we do care delivery currently, it's not sustainable. It's not the quality and safety is not good. So to me, those types of outcomes are the outcomes that I think are important. I also think that I also do triangulation a lot. When I say triangulation, there's a lot of people looking at, say, just EHR data. EHR data, as Rebecca mentioned, only reflects what the EHR is built for, which is basically billing and staying within regulations. And so that means looking at EHR data, but also observing people, also asking people their lived experience, and doing more kind of management evaluation and looking at communication, how teams work together, things like that. So those are the things that I think are more important than some of the kind of point evaluations. And those are the types of things that I like to look at. I think, you know, one of the things that we've talked, I just want to add, one of the things that we've talked a lot about, people have mentioned reimbursement and change, you know, how AI is going to change the healthcare system. I think two important things to me is one, you know, what I mentioned, which is looking at policy and changing how people do things. So to actually trying to affect policy change. But also, you know, one of the things that I innovated with my research team, including Sarah Rossetti, is using nursing data to help answer questions. You know, so I've spent a lot of time on predicting deterioration. And the reason I do that is because, as Rebecca mentioned, nurses are where the rubber meets the road when you think of clinical care, right? And so there's a lot of signal in nursing behavior and nursing data for the entire healthcare system. And so I think that alone, uh, you know, as we get more penetration of AI tools that are built for nurses being used by nurses, will also have an effect on some of these things that we want to have an effect on. Because I know that, for example, at CHOP and at Penn Medicine, people are thinking about nurses and how nurses work in ways that I didn't see people talking about or thinking about 10 years ago. So I do think it's important.
Absolutely. And I think you're so right on that. And when we talk about policy, I want the nurses here to really understand how to get involved, right? So we have students to directors and deans on the call right now, right? From various institutions. We have like a bunch of different specialties here, and they really want to understand, what is the workforce looking like? What is the education looking like? What is clinical practice really going to look like with the implementation of AI? So my question really is, so when we talk about the skills that matter and the knowledge that we need to have, how do we really reshape education and what nurses need to do to thrive and not really just survive in this AI-enabled healthcare system, right? So to you, Dr. Cato and Rebecca, I know that you, Rebecca, you are helping design the AI concentration at FSU, right? The MSN programs. What skills do you think were essential in shaping that MSN program, and what while you're doing it right now? And what future competencies do you think students and clinicians and emerging informaticians really should develop, Dr. Cato? So I'll start with Rebecca, and then we'll go to Dr. Cato.
I think this is really hard, and the full credit actually goes to Dr. Jing Wang, who is the founder. She saw AI was coming 2 years ago and put the program on the books, and just was nice enough to invite me to join her in that journey about a year ago. The world, as Max has said, is changing so fast in AI. I've never been able to see anything keep up or manage it. And so what I would just say to you is that all of us right now are nascent in our understanding of AI. Maybe besides Mac and Kennick, I still consider myself quite nascent in understanding this. So what I would say is you are not too late to get involved. And I think the reality is why I even got involved is Jing actually said to me when I said, I'm not qualified to help you build this program, Jing. Like it doesn't, there's no way that I can help you build this program. And she said, Rebecca, you know more about AI than the technologists know anything about nursing today, and it is being built to offer nurses. And so I said to myself, oh God, I got to throw myself in. Like the reality is they're not going to ask you to come in. Nobody's going to teach nurses to understand IA. Nobody's going to learn the language of nursing. I hate to say it. You guys, how many of you have walked into meetings with your CFOs and your CEOs and you're saying, I think, I feel, I believe, and you're very empathetic in the things you feel. And they say, that's really nice, Nicole, that you feel that way, but can you work Saturday? Because the reality is we've done such a poor job being able to articulate to the business world the skills of nursing. And I think we need more nurses to get out there because they're never going to learn it because they think that what we were taught or what we understand is, and the truth is, I think this is a major failure. It's also happened to physicians. We don't speak the language of business. Everybody teaches us. We spend more time on learning how to change sheets in nursing school than understanding a P&L and business and strategy and operations and having a conversation in a way that articulates our value in a way that others can understand. So if I would tell you one thing, you don't have to know a thing about AI to start understanding AI, because the truth is it's largely going to be based on prompt system unless you're going to go learn how to code. And anyway, I believe the future of prompting to be done right is going to have to come down with nurses. And that's simply one thing, and one thing very important. And I think you've been seeing it, Sergine, working with us, is how you pose the question is how AI responds. And that translation, which nurses have always been the one who sits between medicine and patients, are the people who have always translated this complex workflows and insights into human understanding. That's why when the physician leaves the room, they turn to you and they ask, I'm so sorry, what did he say or she say? And you respond. So get involved, learn it, do not be scared. Start speaking out on LinkedIn, start having conversations. The narrative is happening without us. And because we no longer control the narrative around our own profession, based on the Woodhall study, we've actually lost ground in the media source. We're down from under 4% to less than 2% of all media sources sorting and citing nursing on topics that they are the most relevant to speak on, because we've abdicated our voices for everybody else to speak on our behalf. So if I would say there is one thing, it is for you to drive forward your voice, and that's all that it will take. Because they are looking for you, and nurses are the most trusted profession, not because we have given it away, it's because we have earned that trust, but we failed to utilize that trust to put ourselves in the spaces that we must be. So do not be scared of any program. You are capable, and you just must show up. Dr. Gato, please take over though.
Amen, Rebecca. So what I would say at 100% what Rebecca just said, I think as someone who has started multiple software companies, run multiple software companies, and also was in the military for a long time, I think we need to change nursing education. I think we think too much about teaching the clinical skills. I think we need to teach business, marketing, and leadership. Those are things that we need. I always tell everybody I mentor, I tell them to run your life like it's a small business. And I think that is something that the nurses need to learn. They need to, if you've ever started a small business, there's a lot of courage that it takes to do that. And nurses need to learn and understand that courage, that thing of like, you can do it. Like all it takes to do it is to actually do it. And so the technology piece, it's going to continuously be changing to, what Rebecca was saying. So I don't think that I don't think we need to teach nurses how to code. I don't think we need to teach nurses those types of things. AI is changing every 3 months, right? But if you're a good leader, you know what you don't know, and you know how to find the resources to learn what you don't know, right? And so that's why I think it's business, marketing, and leadership.
Well said. I am loving how we're ending on this. Really, you guys have been so inspirational, honestly. I do want to say, Max, I don't know if you have one little bit of insight for our future nurse innovators on the call. What advice would you give them for nurses who are wanting to innovate, who are wanting to be part of this?
Yeah. Just to repeat some of the things that were said and a quick advice here. So get out there, get involved in things. It became right, and looking at the evolution of this field over the last couple of years, it's incredible how much somebody without super thorough programming background, right, or technology background, that used to be a requirement, right? When myself and Kendrick, we taught an informatics course a while ago, we had to, that had to be taught, coding, all of that, right? These days, you don't have to do that. You have to ask questions, as Rebecca mentioned. The questions have to be grounded and have context. And you can interact with many AI systems. I've seen, so nurses often ask me, like, what are the examples of the cutting edge work in AI? Couple months ago, I was in Singapore and I've visited this hospital. That's one of the 3 hospitals they have. And I spoke to this nurse informatician at the hospital. She asked me this question after telling me how her and a colleague physician are building an ambient scribe system in the hospital. And she is building those prompts that are going to be used to summarize patient-nurse conversation, right? So she asked me, like, what is this cutting edge thing that's happening? And I was like, it's you, you're the cutting edge thing that's happening in nursing. You are leading the field, right? You are the cutting edge now. You are designing those prompts that are asking AI systems to summarize nursing data. You're really embedding your expertise into those systems, and you're teaching them how to understand nursing. That's the cutting edge, right? So it's relatively easy today, I think, to get there. Just start interacting with those technologies, ask questions. That's my advice.
Awesome. Thank you so much for your advice, Dr. Topaz, Rebecca, Dr. Cato. So we are going to round up because we are approaching the end of the session. But before we do, we have a nice little fun, engaging little quick game that we like to play with some of our panelists. And this is a rapid fire question. All right. So how this works is you're going to tell us your one word quick thought that comes to mind when you hear this, and give us, I might give you some responses that you can say either or you just tell us the one where that comes to mind, just so we can get little thoughts on, what you all are thinking with this digital transformation, this digital wave. All right, so we're going to start off with the first question. Charting, necessary evil or fixable problem?
No, fixable problem.
Okay, Dr. Cato, Dr. Topaz?
I think the way we chart needs to be thrown out the window, and we need to use the available technology to do it better.
Oh, gotcha.
To summarize that, evil.
Oh, not even necessary. It's just evil. Got it. Okay,
Evil.
cool. All right.
Evil.
Best tech improvement that you've actually seen. Whew, that means we got work to do, y'all. Oh man.
I am going to give a shout out. Mary Presti is one of the only nurses at Microsoft Nuance to lead that product for the nursing documentation.
I love Mary. Yeah.
Mm-hmm.
So I'm giving her a shout out because I think that was a hard move. And you know what? She's one of the only nurses to survive in that role, in that space, and you guys should keep an eye on her. She's going places. And as you saw, Microsoft posted for the first time ever a lead product AI nurse role.
We saw that.
We did.
We
Yeah.
saw that.
The world is changing,
So
you guys.
exciting.
The world is changing.
It is. It is. It is. Dr.
All
Cato,
right.
Dr. Topaz?
All right.
I would have to.
No,
I would
go.
have to say ChatGPT.
Mhm.
It's
Uncle
not
Chat.
that
Uncle
it's
Chat.
not that
Another one.
it's not that ChatGPT is that great of a product. I think from a marketing perspective, it's gotten everybody talking about AI and thinking about AI, and so I would have to shout out ChatGPT. I think from a product perspective, a data product perspective, it's brilliant to release a product and learn from all of your users to improve your product, right? So OpenAI, they get 2 thumbs up from me. Although I think I should stop there before I get myself in trouble. I'll stop there.
Dr. Topaz.
Yeah, and I would like to give a shout out to Kenrick and his team. So Kenrick and Sarah Rossetti, they developed a tool that uses nursing data, identifies deteriorating patients in the hospital, and then the tool was shown effective in a large clinical trial that they completed about a couple years ago now. And we saw a decrease in patient mortality and other negative outcomes in the hospital.
Awesome.
So that's one of the excellent technologies I've seen.
Awesome. All right.
Thank you, Max.
My last 2 questions, and I know some folks want to hear. Nurses and artificial intelligence, optional or essential?
Is there a word that's more superlative than essential? I mean, I
Give
don't
us
know.
one word. If it's one word, we're trying to
It's definitely essential. Essential plus plus.
Essential plus plus, y'all. You heard it. Everybody on the call, you heard it. Nurses and AI, essential plus plus. Rebecca, Dr. Topaz?
Ditto.
Essential.
Essential 3+.
Essential 4.0. All right, last one for all of our colleagues and friends in the chat. Nursing and technology, future or now?
Past, present, and future.
Past, present. Okay, Dr. Cato, Rebecca, Dr. Topaz?
Now always.
It's the now.
I say the future.
It's the future. Okay. I mean, folks, you heard it now from our phenomenal panelists. Nurses in AI Essential 4.0. Nursing.
Can I just add one thing?
Yeah, absolutely.
And I just, I'm not, I was going to use a slang word, but I'm not just hyping up nurses. But when you think about technology in the healthcare space, there's no other discipline that understands what's going on in the 360 degrees of what's happening in a way that nurses have to.
I agree.
And so, Max mentioned nurses are worried about their job being taken. I love there's a graphic I love to show, like what would happen if you took away the administrators in the hospital? What would happen if you took away the physicians? What would happen if you took away the pharmacists? If you took away the nurses, everything would just screech to a halt. And that's not true just through an inpatient space. That's true in lots of healthcare spaces. So I think it's just a really important thing to highlight the value that nurses possess to innovate and also push technology forward.
Uh, Thank you so much, Dr. Cato. Wonderful way to kind of just wrap this rapid fire. I'm going to go ahead and transition because we do have a few folks that have been asking questions in the chat. And thank you to our panel members that have been responding, because I see that you all have been getting back to folks. So thank you for, supporting us there with that and answering questions. So I do want to go with the first question that we got in the chat earlier today in our Q&A. And the question is, should nursing organizations explicitly claim jurisdiction over clinical AI decisions, similar to how physicians guard scope of practice? If not, why?
Yeah, and that's an interesting question. Like, first brief take, I participated in many nursing organizations thinking about AI in multiple ways, right? And developing a code of ethics, for example, about AI, or thinking about guidance on integrating AI into nursing education. That was the National League of Nursing, right? Or the American Academy of Nursing, thinking about how AI should be used to support their membership. And all of those organizations are releasing reports about that, right? So to some extent, yes, I would say.
I think that's an excellent question. Here's what I would say. The powerhouse in healthcare is the American Medical Association, because they control the only form of reimbursement that exists in all of healthcare. It's not only just for nurses. I mean, right now you're seeing pharmacists fight with this on incident to billing directly, which even the most powerful organizations like Walgreens and CVS are running up against huge ones. I see where you're going with this. And what I always say to people, and why I've got more involved now in starting nursing organizations to drive policy, is I would look for a opening here. And I think one of the places that you could win, and I think it happened, the NLN did this in the 1930s with going for title protection over the title of nurse. I think this is a real risk. I think that AI companies are out there saying there's going to be AI nurses. And I actually find that very concerning and disturbing. So I actually would take a step back, and I first would fight for title protection and professional definition of a nurse first. I think we get there and we fight this tooth and nail because those are real threats that exist today. And if we can establish ourselves both with those two wins, then you have a chance of further articulating other wins. And I think sometimes in nursing, we focus on very abstract issues that people can't take action on immediately because they don't understand it. And that's been some of our problems in nursing. So nursing is STEM. Nursing, even the reimbursement is probably too abstract, but nursing license, title protection, nursing as a profession, to me, are things that we need to be defining, controlling, and taking action on more than this other issue, because I think it's hard to have defined problems that are existential and threat to not only your own profession, but do not land well. And this is something that nurses have done a hard time articulating out. So I like the idea. I love the gumption. I say go with it. But try to think about some immediate wins that could help shape both who you're going to be in the national narrative, because we need many more strong nurses out there speaking and articulating really well across the bow to other professions. And if you can be one of those, we need you more than ever now.
Yeah, and just to add to that, I think we need to me, it's a two-pronged approach. One is policy, and the other one is just populism. Really going to the people and saying, imagine a world without nurses. And that's what the prevailing winds are trying to do, erase nursing. And I think that, it takes really good marketing to do that, but that's what we need to do. We need to really touch emotions. And nurses are the type of people who've had very emotional interactions with nurses. And so if you can bring those two things together, I think that's a powerful way to get where we want to go to.
That's great. I think one of the questions that we did see is, as practicing nurses, what are the best ways to get involved with these new implementations, these new groups, companies or individuals that have these projects. I mean, obviously, this is a great starting point here, but what else can we do?
Max, kind of talk about your guys' settings. One's in academia, you're in the hospital. Kind of how nurses are trying to get involved. How do they?
What I would say, especially in the hospital setting, what I see is two things. One is to participate in clinical level leadership that traditionally hasn't been run by physicians. That's one thing. I think the other thing is really, I just think nurses need to start more businesses and run more healthcare businesses. And so I know, Rebecca, you asked about it in the hospital, but I do think we need to learn the things that you learn from starting and running businesses. That's just what I think nursing as a field and a profession needs to do.
Yeah, and this in academia, right, very specifically, this makes me think about professional organizations. There's a bunch of opportunities with the American Medical Informatics Association, HIMSS, that's another big one. And then any like the New York Academy of Medicine, for example, right, it has a chapter that's focused on AI systems, things like that. So you can find local folks there as well. So these are some of the, things that are effective that I've seen that come to mind. Rebecca, from your perspective, what is that?
So I think it's an excellent perspective, and I think the reality is nurses have to start showing in places that they were not expected. And I would say this openly to anybody I speak with: stop just publishing in nursing journals. Start publishing in journals where those that are deciding the future of healthcare are going to read that. Start writing editorials and op-eds and papers. Start going to conferences like HIMSS and EMEA and Health and Vive. Max Stevens, Dr. Ferreira is going to be speaking at Vive in Los Angeles in February. There's CES. There's JP Morgan. The truth is we must break out of where we have been sitting to break the hierarchical status, because if we keep existing in the systems where they put us, we will never be able to break into the places that we need to be. So I want you to support nursing. I want you to still do that. But I honestly believe the best way to support nursing right now is to get out and start talking to others about what nurses do in ways that in places that matter, because we don't control our destiny, our profession, or the future in these places that we are staying. And the only way we're going to change that is by showing up. There is a quote, supposedly, that Florence Nightingale started to write in her journals in 1870, in which she wrote, "The world is going to take 150 years for me to envision what I have or see for nursing." And 150 plus 1870 is this decade. And I tell you this because I think it's upon us as a profession to either realize what our profession is going to be, or it is going to be ended as we know it. And I don't think we've reached our full potential. And that is not going to be done by doing the same things that we've always been doing in nursing. So I love Kenrick's idea. Start a business. God, is it hard, but not any single day after you do so will you ever regret the lessons that you've learned. I failed in business many times. I did sell my first one, but barely, after I made no money and my mom gave me her nursing retirement. But I am here today because of the lessons I learned through forging the fire of trying to do those things. Loved that advice. Max, I love what you're saying. So I hope to start seeing you guys in the places that we haven't existed.
Perfect. Well said. And I think that's a beautiful way to end this meeting. I'm just going to share my screen one last time. Okay. Okay, we worked through this. So as we close, I really want to share that this conversation is really just a beginning. And our hope is that to continue to create spaces where every nurse, regardless of background or specialty or level of knowledge, in this AI space, can build a solid understanding of AI and its impact on our profession. And thank you so much. so much to our panelists here today for taking the time to speak to us and to just cover us with so much knowledge. Thank you. And so much insight. We're so appreciative of this. And without putting him too much on the spot, Dr. Ferrara, because he did not know. But listen, we really wanted to give you all something to start, an introductory course on AI in nursing. It is created by our very own Dr. Stefan Ferrara, our advisor for this club. And it really, truly is a best starting point for nurses who want to learn more about this space. And you can access this course by scanning the QR code that you see on your screen right now. This same QR code will also connect you with the social channels of our club so you can stay up to date on future events, opportunities, and resources. But thank you all for being here today. We want to extend, again, a huge thank you to our panelists for sharing their time, insight, wisdom with us tonight, and to our incredible e-board, SCNPCC. Thank you all for everything you've done and to make this possible. So without further ado, this is good night and thank you. And this is just the beginning. We'll be back again.
Thank you, everyone.